This still remains a picture of hope, but across a deep pandemic, the variants change. The dilemma does not. Today, new data on the Delta variant further threatens the so-called unlocking, as the variant appears more contagious than the Alpha that led numbers to rocket in late 2020. There are currently over 42,000 COVID-19 cases in England. The Delta variant carries a 60% increased risk of transmission within households compared to the Alpha variant. 90% of those, some 33,000 people, are carrying the Delta variant. Of those, 42 people have died. 23 were unvaccinated. 7 had received only 1 dose, and 12 had received 2 doses.
The numbers are doubling in less than a week at the moment. And so if you carry on thinking about that doubling of numbers that may be going on over the next few weeks, we're going to very rapidly get to very high numbers. And inevitably, that will lead to a lot more hospital admissions.
Here in East London, there's an urgency for the vaccine as COVID looms over our summer. As this new data shows that the overwhelming majority of new COVID cases are of this Delta variant, there is an underlying warning. Although the number of people being vaccinated in centres like this one has been encouraging, there are still people being hospitalised, and the majority of which have not been vaccinated. It's therefore no surprise that the UK Health Security Agency has stepped up its plea to the public to please get vaccinated. However, there are questions over another key pillar of our COVID attack plan. The US-based Innova Medical Group supplies centres like this with lateral flow tests. Now, the American Food and Drug Administration has written a damning warning stating the devices are false or misleading and recommend that they destroy the tests by placing them in the trash. These are the lateral flow tests we have all become familiar with using, that is facing severe scrutiny. Innova, the company behind them, told Channel 4 News that the FDA had not fully evaluated the data. The Department of Health, who have bet big on these tests, say they have confidence in lateral flow tests and that Innova test has gone through a rigorous assessment here, but this will not stop the questions.
It's particularly concerning because not only are we using these tests, sort of surge testing, and mass testing, we're also using them to replace isolation in certain settings. For example, in schools, there are trials ongoing right now that are replacing isolation of contacts with serial testing with these particular tests, which have been shown to be not highly accurate, and having them in classrooms could potentially put children at risk.
Testing is a front line against COVID. In Staffordshire, surge testing begins on Monday. The European Football Championships begins today in Rome, with gatherings across Europe, in England and Wales this weekend. If isolation stops COVID spreading, what happens when this tournament brings an entire continent together as a viral variant grows?
Now, it seems that world leaders may finally have clocked onto the mantra, no one is safe until everyone is safe. Boris Johnson has pledged to donate 100 million vaccine doses to poorer nations in the next year as part of a plan due to be unveiled by the G7 leaders this weekend that will see 1 billion jabs provided to the world. The US president has pledged 500 million. But how far will this really go, and when will those vaccines actually arrive? Altogether, G7 leaders will pledge 1 billion vaccine doses, but the World Health Organization says 11 billion are actually needed to try and eradicate the virus. The grab for jabs by richer countries has been criticized by the WHO. The G7 nations alone have bought over a third of the world's vaccine supply, despite making up just over 10% of the global population. 85% of jabs have gone into the arms of people in the higher income countries. Less than 0.5% of doses have been administered in low income countries. We're halfway through the year, and the COVAX programme, which aims to acquire vaccines for poorer countries, has delivered just 4% of the doses promised. Here in Cornwall, where the G7 are meeting, more people have been vaccinated than the entire populations of the 22 poorest African nations. The aim in the UK is to offer all adults 2 vaccines by the end of September, but for adults across the world, it is the end of next year. A long time to wait, increasing the possibility of new variants emerging and travelling. Well, earlier I spoke to Dr. John Nkengasong, the director of the Africa Centres for Diseases Control. He told me he thought that African adults should be prioritised for vaccines before UK children. But first I asked for his reaction to the fact that more people had been vaccinated in Cornwall, a county of 500,000 people, than in Africa's 22 poorest nations.
Our worst nightmare have come to reality. When this pandemic started, we cautioned that if we did not work in a cooperative way and express global solidarity, we may actually run into a moral catastrophe. I think here we are. There is no other word to describe it today than the situation we find ourselves in, which is really a moral dilemma.
A moral catastrophe. What should this summit do, the G7 summit, the gathering of the world's richest leaders, do in order to deal with this catastrophe?
My message to the leaders of the G7 at this summit is simple. Redistribute those excess doses of vaccines that are currently stored in warehouses in those rich countries. Secondly, do that quickly.
There's a big debate in this country going on about whether children or young adults should be vaccinated or whether those doses should be sent abroad to countries in Africa, for instance. What's your appeal to the British population, to the British government in that particular debate?
Our stand in that debate is simple, that we should be guided by science. And the science teaches us that, yes, young people and children are infected, but they may not actually develop severe disease. So it is important that we strive to vaccinate more globally so that we suppress the emergence of these variants and bring the pandemic under control. And then, of course, that will give us time to vaccinate whoever needs or wants a vaccine.
So African adults should take priority over British children?
African adults should take priority, not in a competitive manner, but collectively. I think the UK has enough vaccines to redistribute and still be able to meet its domestic needs. I think there's absolutely no doubt about that.
Now, the leaders meeting here will say that actually they've been extraordinarily generous. President Biden yesterday pledged more than 500 million doses of vaccine. Boris Johnson, the British Prime Minister, will add another 100 million to that today, and other countries will also weigh in. Are you saying that their generosity just isn't generous enough for the continent of Africa?
We are very thankful for those gestures of goodwill that are being expressed by President Joe Biden and the British Prime Minister. We are extremely grateful for that because we have nothing. So we are very grateful for anything that we have. A journey of 1,000 miles begins with a first step. So we believe this is the first step in a collaboration to enable us get to 1.5 billion doses of vaccines.
If the G7 nations don't provide the vaccines that you need and China and Russia step in to offer them, are you happy to take them from the Chinese and the Russians?
Oh, we are absolutely open to working with any party who has safe and efficacious vaccines. Absolutely no doubt about that.
And finally, the Archbishop of Cape Town has called the situation at the moment vaccine apartheid. Do you agree with him? And if this summit doesn't commit enough doses to get, places like Africa vaccinated, how will this summit go down in your estimation of history?
The inequality and inequity that has characterized the distribution and access to COVID-19 vaccine has been actually concerning and very worrying. And I will not be surprised that the Archbishop will characterize it in those terms. This summit, I'm very optimistic, will go down in the right side of history. The right side of history is that we were, as a planet, confronted with the severest crisis of our time, and we acted collectively and acted with the fierce urgency of now. I think this is how history is going to judge this summit, the leadership of this summit, when the curtain draws to a close.
Dr. Nkengasong, thank you very much indeed for joining us.
Thank you.
Well, let's put some of that now to Dr. Seth Barkley. He's the Chief Executive of the Gavi Vaccine Alliance, which is co-leading the COVAX scheme to distribute vaccines to countries most in need. He joins us now from Geneva. Thank you so much for coming on the programme, Dr. Barkley. First of all, do you share the language and the rather sober assessment that we heard there from Dr. Nkengasong?
I do, and in fact, where we started was to try to have equitable access for the world. That's what we believe is critical. You're only safe if everyone is safe. And the strategy that we originally called for was to start by vaccinating every healthcare worker in the world, then extending that to high-risk groups and the elderly, and then in a more relaxed fashion, reaching the rest of the populations that wanted vaccine, but really to try to stop this from being such an acute disease. And of course, now the variants have only made that more urgent.
So we've really gone away from that strategy, haven't we? Because, you know, some nations have done very well, other nations have got nothing at all. Has the strategy been fundamentally flawed in your estimation?
Well, at the end of the day, I mean, it is a natural thing for political leaders to try to support their countries. And I think I understand that. People worry about their communities, their families, their countries. But I think what we've seen, and you just reported on it with the new variants, you know, we end up with an outbreak in India, you know, within a month, it's in 40 other countries spreading like wildfire, or outbreaks that occur in other countries. So we have to treat a global pandemic as a global problem and come up with global solutions. That's the critical issue.
So the number of 2 billion doses pledged this year to the rest of the world and only 4% delivered. I mean, that's really paltry and frankly, probably doesn't bode very well for all the pledges being made at this summit.
Well, I don't really agree with that, of course. When this all started, we knew that it was going to be a slow upturn in doses because of the fact that most of the doses had already been purchased by other countries. We were slowed down because India, which was a major supplier to the global network, ended up focusing inward. And today we're 190 million doses short from that supplier. But that has now been replaced by other suppliers, and those doses are coming. The reason the dose donations are so critical is they fill that short-term need right now. In the third and fourth quarter of the year, we expect to see hundreds of millions of doses coming from the different producers around the world. And so it'll be a different situation. But right now, what John said is correct. We are in a situation where there are not doses that are flowing.
But John also said that we need 11 billion doses worldwide. And I wonder what the biggest obstacles there are. Is it, for instance, the patents? Is it the trade barriers? Is it blockages in the supply chains?
So first of all, I wouldn't start with the 11 billion doses. We ultimately know that you have to protect the high-risk groups. And so right now, on average, that's 20% of the population. As John also said on children, it may be something that we want to do to slow down spread, but the attack rate of severe disease in children is quite low. So what we're talking about is some number between 20% and, I don't know, 50 or 60% to cover adults, maybe eventually 100%. And I think what's important about that is to have it in a phased fashion. The main barrier has been the doses being made available and production. And so we have to stop any export bans. We have to make sure the equipment flows so that every manufacturer in the world can produce doses. We have to make sure companies prioritize global supply. And of course, we have to, in this short term, take the doses. There's now about 1.5 billion doses that are excess doses because when countries began to buy, they didn't know if any of these vaccines were going to work. So they bought many different vaccines. And now those doses can be donated, which will make a huge difference if it's done now to begin to protect the high-risk groups around the world.
Dr. Seth Barkley, thank you very much indeed.